Hello, I'm Dr. Susan Chandler of Massey Cancer Center's Integrative Health Program. I'd like to welcome back Dr. Autumn Lanoye, clinical psychologist and research scientist for the Survivorship program at Massey Cancer Center. Dr. Lanoye specializes in helping people make lifestyle changes when they're coping with such illnesses like cancer. One of the challenges we frequently hear patients describe is what they call chemo brain. During this presentation, Dr. Lanoye will address cancer-related cognitive changes beyond chemo brain. This talk will describe common cognitive or thinking problems experienced by people with cancer before, during, and after treatment. And in addition, Dr. Lanoye will describe strategies for improving cognition and provide resources for addressing these difficulties. So Dr. Lanoye, thank you for being back with us to talk to us about cognitive issues.
Of course. Thank you, Dr. Chandler, for that introduction. And thank you for having me back. I always appreciate the opportunity to share things that I'm passionate about. And this is definitely one of those topics. A couple disclaimers before we get started. I am not a physician and I'm not a neuropsychologist, which is someone a psychologist who specializes in cognition. But as I mentioned, this is something that I'm passionate about. And I've done a lot of work in the neuro-oncology clinic here at Massey Cancer Center, working with people who have experienced cancer-related cognitive changes. So that's kind of my perspective heading into this presentation. Okay, so just an overview of some of the things we'll be covering today. First, talking about the ways in which cancer can affect the way that we think, so those cognitive changes, different types of cognitive changes that people might experience throughout the cancer trajectory. We'll spend a lot of time talking about strategies for improving cognition, and then at the end, I'll have some resources for addressing cognitive changes. So first, thinking about cancer and cognition, a lot of people, like Dr. Chandler mentioned, are familiar with the term chemo brain, and it kind of has been understood as this nebulous cluster of symptoms that people kind of describe as like brain fog. Like it's hard to think, it's hard to concentrate, and that's kind of how it's been known clinically for many years. And what we're recently finding out, and a lot more research attention has been paid to, is that it's not just chemo that can cause those cognitive changes. The disease process itself, so cancer itself before any type of treatment, can cause cognitive changes. And the rates differ based on cancer diagnosis, but about 10% of people with cancer report cognitive changes and cognitive decline before they've received any type of treatment. So that tells us that something is going on biologically before any intervention is done. And then we've also learned that it's not just chemotherapy that can influence the way we think either. Cognitive changes have been found among people after surgery, radiation, hormonal therapy, immunotherapy. So really all of these types of treatments have been implicated in producing cognitive changes. So for that reason, we'd like to think of it as not just chemo brain, but there's this broader term, cancer-related cognitive impairment or cancer-related cognitive changes, that really takes into consideration the fact that these are problems for people outside of chemotherapy. So we don't want, if people are noticing cognitive changes but haven't received chemotherapy, they might think, oh, I don't have chemo brain, it must be something else. It may still be related to the cancer process. So this broader term just kind of acknowledges that and honors that for people who haven't received chemotherapy. And one of the major forces behind research in this area is the International Cancer and Cognition Task Force, the ICCTF. And their mission is to standardize the way that we assess cognitive changes over the cancer trajectory, and really try and figure out the causes, the biological mechanisms by which these things are causing cognitive changes, because right now there are a lot of unknowns. First of all, there are a lot of different cancer types. There are a lot of different treatment options. There are a lot of different ways of measuring cognition. So their mission is really to try and standardize the way that we study this so that we can learn more efficiently about cognitive changes related to cancer. So that, these are some things other than chemo that we've learned have contributed to cognitive changes throughout cancer. There are also other things to think about that, of course, complicate the picture even more. So psychological reactions to cancer diagnosis and treatment, or, psychological conditions in general that people might have had even before they had a cancer diagnosis. So depression, there are a lot of cognitive symptoms that are associated with depression. So impaired attention and memory, difficulty with problem solving, slower thinking, lower processing speed. All of those are symptoms of depression. And all of those are also some of the cognitive changes that we see with cancer and its associated treatments. Same thing with anxiety. Anxiety has cognitive symptoms. So difficulty with attention and concentration, being easily distracted. So sometimes what happens is that people experience cognitive changes that may be attributable to cancer and its treatment, but sometimes they may be attributable to some of these psychological factors. And it can be difficult to tease out, but that's the job of people like neuropsychologists and other specialists in this area. And then, of course, things like sleep and fatigue. In your typical life, if you think back to a time when you weren't getting great sleep and you went to work the next day, you might have noticed that your productivity was down, difficulty concentrating, those types of things. That affects all of us anyway. And that especially affects people who are already vulnerable to cognitive changes. So another thing to consider as well. One thing I want to talk about is how we measure cognitive change. So I mentioned that there are a whole bunch of ways to do that. One is self-reported measures. So this is where we ask patients to fill out questionnaires that ask about their day-to-day functioning, how they feel like their cognition is, whether or not they've experienced changes in different domains of thinking. And then the other is neuropsychological testing. So this is where we have people perform tasks, ask them to do different things, and then those tasks are scored and compared to normative samples. And we can kind of tell, are you performing where we would expect you to? Are you performing above where we would expect? Are you performing below where we would expect? And one of the things that has been found in the research is that there are differences in rates of cancer-related cognitive impairment depending on what type of measurement we use. And they tend to be higher in self-report than objective measures. So this doesn't mean that, people are lying or misrepresenting things on self-report measures. There are a lot of different reasons why this might be the case. So first, as I mentioned, are those psychological and behavioral factors where people might be experiencing some of those cognitive symptoms and cognitive changes, but they may not show up on neuropsychological testing because they're more attributable to things like depression or anxiety. There's also a huge difference between asking someone about their day-to-day experience and bringing them into a testing environment where it's very controlled, it's quiet, you can concentrate a lot better. So just kind of by nature of the way that things are set up, people may perform better in a testing environment where things are set up for kind of optimal functioning, as opposed to being at home where people are dealing with family, kids, going to work, all the things that they have to do in their day-to-day life, where some of these things might show up a lot more. And then lastly, there may be flaws in the testing that we have available. So a lot of the changes, cancer-related cognitive changes that people experience are really subtle. And the testing that we have might not be able to pick up on the things that people are noticing in their day-to-day life. So that's an area of additional research as well. I want to briefly touch on the types of cognitive changes. So initially I mentioned that chemo brain is just kind of thought of, general brain fog, but there are specific aspects of cognitive changes and cognition that tend to be associated with cancer and treatments for cancer. So the first is in memory. So short-term memory, where people have difficulty remembering names, remembering dates, difficulty remembering specific information or events. An example might be, if you're having a conversation with your family and they say, oh, remember last week when we were talking with Uncle Joe and he said X, Y, and Z, and you're like, no, don't remember that. That's an example of a short-term memory disturbance. And then people also have difficulties with working memory. So this is even shorter than short-term memory. So this is when if you go to look up a phone number and you're trying to hold that phone number in your head while you're about to dial it, that's an example of working memory. So if you forget the phone number before you get to the phone to dial, that's an indicator of working memory. So it's kind of that holding information in your mind and manipulating information in your mind. So also things like mental math or those types of things, working memory is involved in. And then another domain that's commonly affected by cancer and cancer treatments is attention, and two main types of attention. So sustained attention. So this is when you're trying to concentrate on something for a prolonged period of time. So reading a book, watching a movie, trying to focus on one task for a long period of time. And if you're noticing distractibility, or if you're noticing having to go back and reread the same sentence over and over, that might be an indicator that you're having some difficulty with sustained attention. The other type of attention that we commonly see problems with is divided attention. So this is when you're kind of trying to focus on two things at once or alternate between two things that you're paying attention to. So if you're at work and trying to type an email and someone's talking to you at the same time, that's an example of a time when you might have to divide your attention between two different things. So if you're typing the email and have no idea what your coworker is saying to you, or vice versa, you got what your coworker is saying to you, but then there are a lot of typos in the email or a blank email, that might indicate some issues with divided attention. Another area that we commonly see difficulty with is processing speed. And I think this is kind of that brain fog that people are talking about, where it just takes longer and more effort to do things that you normally do. It takes longer to complete tasks that you're used to completing and in the past haven't taken you very long to complete. Writing emails, doing things at work, doing things around the house, just finding that it takes longer and it's much more effortful than it typically is. And then another domain that we typically see changes in is executive functioning. So executive functioning is kind of combining some of the skills that we've previously mentioned. And it's really responsible for a lot of higher order thinking. So things like abstract thinking, hypotheticals, planning. So if you're thinking, all right, step one, I have to do this. Step two, I have to do that. Step three, I have to do this. That's executive functioning. Cognitive flexibility. So if you encounter a problem when you're trying one approach, how quickly or how able are you to try a different approach, or, try a different method? And then problem solving as well. So when you encounter a problem, how able are you to find a different solution or any solution to overcome that problem? And one thing that I want to point out is that these things are or can be things that anyone experiences in their day-to-day life. If I've had, again, a bad sleep the next day at work, I'm having trouble thinking of words. I'm making typos in my emails. I'm having trouble paying attention. So to some extent, all of these examples are things that are parts of our normal lives. We've all had the experience of forgetting someone's name or having difficulty thinking of a word. It's on the tip of our tongue, but we just can't get it. So to some extent, these are all within the realm of normal functioning. And so the issue is really when these things become a pattern over time, and when they're interfering with your day-to-day functioning, when they're interfering with your work, your social relationships, your mood, and those types of things. So that's kind of when to think about that border between what is within the realm of normal everyday cognitive slips and what might be an issue that you might want to bring up and talk more about. So if you're noticing some of these cognitive changes, some of the first things to do are keep track of them. How often do they happen? When are you noticing them? Is it at certain times of the day, worse in the morning, better at night, those types of things. And that can really help when you're talking about these things with your physician, can really help your physician plan next steps for you. So trying to keep track of when these things happen and what it looks like. And sometimes your friends and family members might be able to help you out if you ask them, and if that's something you want to ask them to do, in kind of helping keep track of some of these things. One thing that your physician may recommend based on what you've observed, what your family members have observed, is completing a neuropsychological assessment. And so this consists of a clinical interview where the neuropsychologist will ask you questions about pretty much what I just described, what you've noticed in your day-to-day life. How do you know that something isn't quite right? How do your friends and family know? How is it impacting your life? They'll also have you fill out some of those self-report measures that I mentioned. So some questionnaires that can help them get a better idea of how it's impacting your daily life. And then they'll also do some of those tasks that I mentioned, some of those performance-based measures, where they'll ask you to solve problems or do different things. And then at the end of the evaluation, they can kind of score all that up, and they'll be able to tell you, you're performing about where we think you should be, better than you should be, or a little bit lower than where we think you should be. And based on that, they'll provide you with specific feedback. So based on the patterns of cognition that they find, based on the interview that you've given them, the assessment feedback report that you'll get will give you really specific suggestions for how you might address some of the things that they found, if they found any types of impairment or decline and things like that. So that's one thing. If you do complete a neurological assessment, they'll have some great feedback for you. Some general coping strategies that you might find helpful. I like to call it externalizing your brain. So whenever possible, take the pressure off of your brain to remember things, attend to things. So putting into place things like keeping a calendar, taking notes, making lists, leaving reminders for yourself, setting alarms. So as much as possible, you're taking the load off of your brain and putting it in something else's hands, whether that's technology, whether that's a journal, a notebook, a physical calendar, whatever works for you, but using some of these strategies to help compensate for some of the changes that you're noticing. Another one that I like to tell people is to practice patience with yourself. So it can be very frustrating for people when they're first noticing changes. It's already frustrating when, if you can think of your own experience, how frustrating it is when you've forgotten a name or a word is on the tip of your tongue. If you're experiencing that over a long period of time and it's getting worse, that's really frustrating. But that frustration psychologically only makes things more difficult. So taking some deep breaths, stepping away from the situation and coming back to it later, and just being patient with yourself can go a long way. And then also sharing the difficulties that you're experiencing to the extent that you're comfortable doing so with your support team, whoever that is, your family, your friends, coworkers, letting them know the areas that you're having difficulty with and asking them for help. Saying, I know you told me this story last week, but I've forgotten it. Can you tell me? Or I know you've introduced yourself. I've forgotten your name. Can you remind me? Those types of things. But just kind of being open as much as you're comfortable doing so. And then, so kind of beyond those coping strategies, there are some concrete things that might be recommended by your physician or might be recommended by a neuropsychologist if you see one. So one of those is occupational therapy or cognitive rehabilitation. And these are specialists who either depending on the types of problems you're having, can either help to retrain your brain. So help you complete tasks in the specific area where you're experiencing problems, to help kind of gain some of that ability back if that's possible. It's not always possible. So in that case, they help you develop compensatory mechanisms and approaches. So, and really individualized to the specific problems that you're experiencing. And they also help with functional activities training. So if you're experiencing difficulty in a specific area, like driving or a specific process at work, they'll help you kind of figure out what's the best way to tackle this problem specifically. So it's a really intensive program. It's a personalized program. And so it can be a really great option if that's feasible for you. Another is psychotherapy for a few reasons. So one, again, I mentioned that feeling of frustration. So in therapy, we can talk about techniques for managing your emotional reactions to the cognitive changes. So frustration is definitely one. Anger can be another one. Sadness. But tips for kind of managing how you're coping with the cognitive changes that you're experiencing. And then, as I mentioned previously, depression and anxiety, if you're experiencing those symptoms, can only serve to complicate things. So in therapy, we can work on resolving depression, resolving anxiety. And in that way, it's possible that you might notice some improvement in cognition just because depression and anxiety have cognitive effects as well. Also in therapy, we could spend time with your partner, other family members, whoever is on your support team, to work with them and to help minimize stress, because it can be stressful not only for the person experiencing the changes, but also for the people in their lives having to potentially repeat themselves or remind. And so just really kind of setting up a plan that works for you and the people around you so that everyone is on the same page, and everyone is having as minimal stress as possible while you're working through this. And then it would not be a presentation by me if I did not mention exercise. So there's some really great research coming out that physical activity can improve cancer-related cognitive impairment. The two types of physical activity that have been studied the most are aerobic physical activity, so things like walking, jogging, even if it's just for 10 minutes, can be really beneficial if it's a routine that you build up over time. And also yoga has demonstrated some really great effects in improving cognition as well. And then also, as I mentioned, if you're not getting enough sleep or enough quality sleep, that can also further impair cognition. So to the best of your ability, making sure that you are in a good sleep routine, getting enough sleep, getting good quality sleep. And you can refer back to my previous talk where I talked about sleep during the cancer experience for some tips on how to do that. And then lastly, I just have some resources here. This first one is a brochure by the American Cancer Society. If you just Google getting help for chemo brain, it's a PDF. It has some great tips. Another is through cancercare.org. And if you just search by topic for chemo brain, they have a great variety of resources there as well. Again, chemo brain is probably still the best way to Google for some of these things, even though we've kind of moved beyond calling it that. But you can search for chemo brain, you can search for cancer-related cognitive changes, and both of those searches should get you to the same places and the same resources. And then lastly, as I mentioned, the International Cancer and Cognition Task Force is working to further research in this area. And so they have some resources as well, and they have some good kind of reviews on what we know, the state of the science, and what we still need to learn. So if you're interested at that level, that's a great resource to check out. And then if you have any other questions that we can't get to today, you can email me, you can tweet at me, or get in touch in whatever way you'd like. So that is all I have for you today.
Well, Dr. Lanoye, that was really very informative. And also, I would think for those who listen to this, it will also be somewhat comforting to know
Thank you.
they are not alone, that there are things that they can do,
Yes.
and that there are multiple reasons for this,
Yes.
without and before treatment, just the stress of it. But
Exactly.
yes. And so if there was one thing that you would like your viewers to take away from this, what would you say that would be?
Yeah. So I would say, if you're viewing this and you're experiencing some of these things, don't be afraid. Don't feel bad. Don't be too proud to try some of these strategies. It doesn't mean that you're a failure. It doesn't mean anything negative about you, that you're, that you need to make a list or that it's helpful to keep a calendar. It's just going to improve the way that you function in the world, and it can only serve to help you. So a lot of times I hear people kind of getting stuck on, I should be able to do this, or I used to be able to do something this way. And yes, that's true. And it's frustrating. And now the challenge is, okay, how are you going to accomplish those same things in a different way? And there's nothing wrong with that. And there are a lot of different ways to get to the same goal. And so it's really about finding what works for you. So I'd like people to take away what you mentioned, Dr. Chandler, that you're not alone. As best you can, try not to let the frustration get to you, and just try alternatives. Try things out. Try technology. Try pen and paper. Try working with your friends and family, or following up on some of the resources that I mentioned in this presentation.
Thank you so much for all of that. We hope you'll
course.
come back and speak to us again.
Anytime. I really appreciate the opportunity. So thank you, Dr. Chandler.
Thank you.